Howdy, howdy.
So I'll just introduce you. Anthony Welti is a Libertarian candidate for Washington State Insurance Commissioner. It's great to have you, Anthony. I thought I would just let you introduce yourself a little bit more. Anthony, can you explain further what this office you are running for is and what is your platform?
Yeah, I appreciate you kind of starting this conversation. Insurance is something that's talked about a lot in this day and age in the political worlds of, healthcare, Medicare for all those things. And the position of insurance commissioner is one that here in the state of Washington is an elected position that has immense power and control over how the industry is regulated and what policies you have access to and what rates you pay. So I'm excited to be running for this position. I have a background in insurance, specifically property and casualty insurance, which would be your home, your auto, your small business insurance, your motorcycle, your boat, your RV, and everything in between. So it's a wide topic in the sense that insurance affects multiple areas of everybody's day-to-day life, and is really a position in government that has been hidden in the shadows here in Washington. So my objective is to do a couple of things. I want to make government and insurance more accountable, accessible, and affordable to the average person. I think most people feel like government doesn't represent them and that their insurance policies aren't offering them what they wish they did at prices that they could afford.
I would assume from a libertarian perspective, you think that is more because of government involvement in the marketplace than because of what the private companies are doing.
I think it's a little bit of both. I think that the industry's in the industry's best interest, they want to be able to provide choices to people that resonate with them, right? We see this across the markets in every other industry that are less controlled by the government, right? For example, you can walk down the cereal aisle and there's a cereal for everybody there. Nobody's complaining about lack of cereal or lack of choice in cereal. But for some reason, when it comes to insurance, specifically health insurance, people don't have the coverages that they want. They don't have the product that brings value to their families. And I think part of that is corporate greed. There's been a lot of powerful companies that have lobbied their way into power and have really stifled the way that the industry could otherwise work to help empower their own shareholders in their own company. And that's, a cronyism that needs to go away. Because if we do that and we remove those control points, what you'll find is better business practices will start coming to the forefront. Companies will be forced to compete within the realm of ideas and products because there'll be more flexibility for folks like you and I to basically say, no, we don't want this. We're going to go across the street and buy it from this other company. And insurance is one of those few industries in the country right now where you can't easily do that. If you're unhappy with your cell phone, right, you can cancel your Verizon or your AT&T or whoever and go to your T-Mobile or your Boost. If you're unhappy with Comcast, while there's not even really, there's a big captive market when it comes to internet, to cable, at least you can cut the cord and go to, Hulu and Netflix, right? There's some market flexibility there. But when it comes to insurance, we just don't have those same types of choices. And I think we need some forward thinking, maybe some more modern, innovative ideas that if we just allowed these things to happen, we'd find some better choices and some cheaper prices.
All right. So with COVID-19, a major fear is that we're not going to have enough resources to treat all the sick people. And how could free market reforms help to prevent that issue?
This is one of those moments where libertarians, can kindly say, we told you so. And we're doing that right now, or I'm doing that right now, not because I want to be right. It's because I want our solutions to start coming into work before the next pandemic, right? There's a lot of things right now with not having access to little things like masks. The nurses, the first responders don't have enough masks. Well, these masks exist. I'm actually working on a project right now to import them on an individual basis, and get them through customs by shipping in lower amounts that don't catch the eye of customs. The government restricts the flow of goods and services at a multitude of different levels, at the state level, at the federal level specifically, where they limit access to things. And then that on top of it, they add tariffs and taxes and fees on every step of the way. So, if you want to get a mask right now from, let's say a country that's not having an outbreak, and they're like, yeah, we got 10 million masks. First off, we can't order them directly. Second off, even if we did, the government's going to tax every single one of them and then add a fee when it crosses the border to get to us. So opening up the market, allowing people to conduct business freely with one another, and really being a catalyst to those types of transactions as opposed to a hindrance, I think would directly have a correlation on the issue that we're seeing right now with the coronavirus. So my hope is going forward, things like tariffs on medical products, things like certificate of need laws that reduce the number of medical facilities that are in a community, taxes on medication, right? I hope that this shows us that we need to remove some of these control points to make things cheaper and easier so that medical professionals can do their jobs and help keep people alive.
So you talked a little bit about this on the Tom Woods show with the certificate of need laws. Can you explain to me a little bit more what that's about?
Yeah, so a certificate of need law is, think zoning regulations on steroids, specifically for one industry, the medical industry. And those zoning regulations are often controlled by certain special interest groups, right? And what that does is it limits the ability for a new medical facility to open up in a community. It limits an existing medical facility from opening up more space. Something like if you have 10 beds and you want to add 10 more, the government could tell you no. And oftentimes the people that are in government have positions or have had positions of authority in hospital boards, CEOs of hospitals or different mega corporations, right? And that's varies state by state, jurisdiction by jurisdiction. So, what maybe slight issue we're having in California maybe isn't the same exact issue on that same topic that maybe Washington's having. So there's some variance there. But ultimately what it's doing is it's restricting the growth of medical care. It's slowing the creation of more medical facilities, and it absolutely needs to be abolished immediately. If you or I can fundraise $10 million to build a small hospital in a community, we shouldn't need permission from the government to do so. We should be able to open that, and we should be able to do it immediately.
Completely agree. So you're running in Washington, so let's talk about your state. What are some specific reforms in Washington that could be made which would help to lower insurance costs and increase the quality of coverage?
Yeah, so different things for different lines of business, but the number one thing we need to do is we need politicians to stop taking a cut of the pie. Okay, what I mean by that is a lot of politicians claim they want insurance to be affordable, but what people don't know here in Washington is there's a hidden tax on it of over $600 million a year just at the state level in taxes on insurance. That's $600 million coming out of the pockets of Washingtonians that need not exist. All that money does is it goes in the general fund where it disappears and dies for whatever pet project whoever's in power that year decides to use it for. I believe that money should stay in the pocket of the consumers so we can more easily afford insurance right off the bat, and that requires less welfare, which will kind of stop the perpetuating of the system. So that's one thing in insurance in general. In car insurance, the insurance commissioner that's in there now supports things like mandatory credit checks every 3 years for somebody's car insurance. So what that means is in 6 months, if your policy's coming up on its third renewal, for example, and maybe you just lost a job and your credit took a hit because you haven't been able to pay a couple bills for the last few months, your credit will be going down because we're in a bad economy. Well, now your insurance carrier is required to check that credit, and then they're required to adjust your rate accordingly, which means if you just lost your job and are having a tough time financially, the insurance commissioner has made it mandatory that the insurance companies raise your rates with the policies that he has. I believe we should abolish that rule immediately and put that control back in the consumer. If you've had a life situation where your credit's gotten better and you want to go get it checked and you want to get a better rate, we should be empowering that. But for the folks that are having tough times financially, the last thing we need is one size fits all rules that further diminish that probably poor person that's barely making ends meet right now. So I think that would have an immediate impact in today's economy that we're seeing because of this virus. I think it's short-sighted to not have already unilaterally waived that requirement, which the insurance commissioner has the power and authority to do.
So you talked a little bit about politicians taking a cut of the pie with the taxes, but on your campaign website, you also talk about how the insurance department is too big and how they're getting paid too much. What is, kind of a balanced, this is how much they should be paid, and this is how big the department should be?
Yeah, well, right now it's a department nobody knows even exists. So the first pragmatic thing we need to do is just educate people and the general public on the importance of this position and how it impacts their lives. And that's taking out politics. That's not policy. That's not, my ideas are right and his are wrong. That's just people knowing what government's doing. And so far, that the people that have been in power, specifically one guy the last 20 years, has just refused to even make an attempt to do that. With that said, the department itself is 240 employees. A lot of that is paper pushing. We need to go through and we need to eliminate as much red tape as possible and then unfill positions. The other thing is specifically the pay of the position itself. So all the other positions are hired hands. They're workers, average people. They're just looking for a job. A lot of them are making, $3,000, $4,000, $5,000 a month, right? Real average jobs, right? I don't have issue with those people, right? They're doing the best they can to feed for their family. What I take real issue with is the insurance commissioner getting a raise from $120,000 2 years ago up to $137,000 this year. And that happened because the entire state government got a raise. All 7 of the state level government elected officials all got raises. That wasn't by public vote. That was because a committee of appointed people by the governor voted for the governor and his friends to get raises. So I'm running for a position that just got a raise. For a lot of people, that sounds awesome, right? Usually you're shopping for a job, you're looking for a promotion, a better pay. In the free market, I think that's absolutely the way things should be. But when it comes to government, which is supposed to be service to community, service to state, service to country, we don't need politicians getting giant raises while other people are losing jobs, where they're not seeing bumps in income, where they're getting better health benefits than the average person working at Fred Meyer or Safeway, your local grocery store, gets, and then getting pension on top of it. So I'm advocating for a 50% reduction in the position or the salary that my position would get paid, and to make it so all government politicians have to buy insurance and other benefits on the open market, just like the average consumer has to. They shouldn't get some top-notch health coverage that the average citizen doesn't have access to. So that's taking, that's taking a normal concern that a lot of people have, that politicians get paid too much, that Congress gets paid too much, that their pensions are too big, that they have better benefits than we do. And instead of talking about it and then continuing to take it myself, I want to be the guy that helps sponsor, legislation or get somebody to write that legislation and get it passed into law. I even want to work on an initiative to put that vote to a vote of the people if the legislature isn't willing to do it. So I've got some ideas there, and ultimately it comes down to the basic principle that these people are there to serve us, not profit off of us.
Appreciate that. So many states have an insurance commissioner and large insurance oversight departments. So from a libertarian perspective, what would be the purpose of this department, if any?
Yeah, so it's a consumer protection agency. And the main task is really trying to make sure that people are trying to, or that both companies and consumers are adhering to contract law. I absolutely believe that freely entered in contracts should be enforced, and I believe that there's a role for government in that. I believe that it should be voluntarily funded, and it should be voluntarily associated with, though. So in my ideal world, a position like this doesn't have to be abolished. It just needs to be funded differently. It needs to be funded by people that care about these things, that want to pay into this protection or this government entity voluntarily, and that insurance companies get to associate with it voluntarily. And that could be something as simple as a check mark on their website, a verified type link that Twitter has showing that, yeah, this is a reputable company that's got the check mark from the right, um, business group, right? We see that in other areas. We see it. You go to your local auto repair facility, they have accreditations on their front door. You go to your local insurance office, they also oftentimes will have different accreditation agencies that are not government, that they say, we're backed by such and such agency of sorts, right? That gives credibility to them as a business within the industry. So I think there's ways to really self-regulate these companies without forced taxation and association to a program that the average person doesn't even know what it does. They're just counting on it doing the right thing. And that's been shown to this point in time that it's simply not, because people are paying too much for their insurance. Nobody's happy. And instead of continuing to perpetuate what is obviously broken, I think we need to start looking at alternative solutions.
Thank you, Anthony. So where can people find you?
Yeah, one of my things is to be as accessible as possible to people. I got involved with politics as an activist, and one of the first things that I got frustrated by was the inability to have my voice heard. And what I mean by that is, if you live more than an hour away from maybe the state capitol, for example, you basically have to burn a day off of work to go have your voice heard if you want to, go complain about a piece of legislation. And specifically with this position of insurance commissioner, we've got a guy in there that doesn't talk to the general public, doesn't know who he is. So my Facebook page is extremely active. You can find me using the hashtag #BeFree or hashtag Welti, the number 4, and then WA, or look me up by my name, Anthony Welti. And if you want to talk, I'm happy to schedule a call. I will respond to your private messages. I don't have a team responding to those unless it's a super generic type question. I go through and I answer all those myself. And that's what I'll continue to do if I get elected to office. My Facebook, Twitter, same thing. Look me up, hashtag #BeFree. And I have a website, anthonywelti.com as well.
Hashtag #BeFree. That's great. Thanks for talking to me today, Anthony.
Yeah, I appreciate it, Josiah. You take it easy, and I'm always happy to answer questions and let people know kind of what my solutions are. I think, we need to come together as a society in this sense and admit that what we're doing isn't